Well, in 1992, we had a visit from a doctor who heads a clinic called Rotacare in San Jose, California. He was meeting, he happened to be a Rotarian, he was meeting with a Rotary Club in this area and brought forth this idea about how this Rotacare clinic was serving the needs of the underserved in San Jose County, and actually had become the health care arm for San Jose County to run their clinics.
I am the CEO of the busiest heart center in the northeastern United States, and not far from us is a little and virtually unknown free clinic called Rotacare.
Rotacare is a nonprofit agency. Our volunteer doctors, nurses, and support staff provide free health care for people in need.
Today we see over 2,000 patients with $400,000, which is not a lot of money. We open 2 days a week for 10 hours, and now we are going by appointment only because the clinic has become so large that we're not able to serve the community as a walking basis any longer. The clientele that we attend to are the poor of America that really have no other place to go.
You encounter them each and every day. You see them each and every day. You may not know them. They may be anonymous to you, but they're there. They support you in many different ways that you may not realize. They keep our economy going.
These people are not freeloaders. They work hard. Many of them work at 2 jobs a day to support families, to pay rent, to make ends meet.
They may be anonymous to you in that they're not a member of your family, they're not in your circle of friends, they're not amongst your coworkers, but they're fellow human beings.
It became obvious from working there that we were really dealing with the working poor. These are people that by and large work in plastics factories, housekeepers, etc., but yet cannot afford health insurance, nor does their employer provide health insurance to this population.
In 2004, Daniel Alvarez hurt his back on the job. He ultimately ran out of health insurance and found it impossible to get the necessary medical treatments until he found Rotacare.
My dad received everything from patient doctor visits to medication to other specialists outside Rotacare, and that was all free for us. So it was a burden lifted off of us and our family. People here need this place.
With that notion, a group like us is what stands between them being in some ER, in some hospital someplace, versus continuing to lead successful lives.
That's why we went into medicine. You go into medicine to help people, and when you see somebody who's so appreciative that you really made an impact on your life, no matter how hard you work or what stress you're under, that makes it all worthwhile. Rotacare is a way for all of us to help people who don't have what we have.
Many Long Islanders fall through the cracks when it comes to health coverage. They are for one reason or another not able to get medical attention and often depend on emergency rooms for care, which ultimately drives up the cost of health care for everybody.
If you have an honest job and you do it well, you make the world a better place. But making the world a better place is actually difficult, complex, and often expensive. The piece that's missing, the piece that needs your support, is based at Rotacare itself. Rotacare needs volunteers, and Rotacare needs cash.
We need help with volunteers, physicians, any ancillary staff. We need money, we need time and support. Money is especially important for Rotacare at this point in time.
America has been good to us. We want to give back. And I think that's the core of where we have so many good people.
Rotacare is there on the front lines, helping people who need help, helping those people that you don't know, helping the anonymous amongst us who are also fellow human beings. That's the reason why you want to write the check to Rotacare.
Without Rotacare, our patients have no one to care for them. They have no one to take care of them. I have to say, What am I here for? And I'm here to serve.